I'm sure it was a long day. It has been for the health community a very exciting day with very important commitments, very important announcement, an incredible mobilization on change, on action to protect people's health, and more than anything, recognizing the health argument for climate action. There are so many health benefits that can be obtained from tackling the causes of climate change that we don't understand why more action is not taken. But I'm sure that with all the efforts we are doing, all of us and the people attending this meeting and those who will be making contributions, those who are following on a very critical way our Twitters and social media, and many people is very excited about the commitments made today, and is giving them hope that finally the health community will be putting here some action and will give some hope at the end of this meeting. I'm very pleased to be here at this Health Argument for Climate Action meeting. This is, as you know, part of the COP26 Health Programme. And of course, before starting, I need to take the opportunity to thank all of those who help us and are co-organizers. This is a UN event and therefore organized by the World Health Organization, but in collaboration with UNFCCC, OHCHR, IOM, UNECE, UNDRR, UNHABITAT, UNICEF, WMO, UNDP, and keenly supported and very well supported by the UK COP26 Health President team. So thank you very much for that, and thanks to all the UN agencies who join in forces with us, convinced that this health argument is a good reason why we need to be together. I will be your moderator. From the World Health Organization. I'm Maria Neira, and probably very much committed to what is happening here today, dedicating all our efforts in WHO to convince anyone, if people is not yet convinced, that climate change is affecting our health, but more importantly, that if we tackle the causes of climate change, the health benefits that we can obtain, cleaning our air, making healthier diets, and making a more mobile, healthy population living in more livable cities, that will be all a success. To start this discussion about what is the health argument on climate change, for climate action, it is my pleasure to invite the Honorable Minister Wendy Morton. She's the Minister for Europe and Americas at the Foreign, Commonwealth and Development Office, and she has been following very carefully the day-to-day, making us very happy with some announcements. Minister, you have the floor. Thank you. Come on, an applause. I know that you are excited.
Thank you, everyone. It's been a long day, and we're not finished yet, but it has been a good day so far, I believe. Coming to health and to climate, we know 150,000 people die each year from climate change, and that the climate emergency is already a health emergency. We know that the climate crisis will affect the most vulnerable, and it will accelerate health inequalities. So the health arguments for addressing climate change are powerful, and the need to curb emissions from this growing sector is obvious too. And this is why the UK presidency selected health as one of our COP26 science priority areas. And it's why we have worked in partnership with the WHO, UNFCCC Climate Champions Team, Healthcare Without Harm, and the Global Climate and Health Alliance under the banner of the COP26 Health Programme to make the sector a resilient ally in the fight against climate change. In the build-up to COP, we have worked together to advance 4 important goals. The first has been to amplify the voices of those health professionals who are pushing for more ambitious action on climate change. Healthcare professionals in many different parts of the world are telling us that climate change is already damaging patient outcomes. More than 460 organisations representing over 46 million health professionals, signed the Healthy Climate Prescription Letter, calling on national leaders to deliver real action on the climate crisis in order to protect people's health. And I thank the Global Climate and Health Alliance for their coordinating role in amplifying the voices of the healthcare community here at COP26. Our second goal has been to develop and share knowledge about the impact of climate change on health and healthcare and how we best adapt to it. To deliver this, the COP26 Adaptation Research Alliance led a consultation and made recommendations earlier today that will help shape research into resilient healthcare systems. Our third goal has been to increase the resilience of the health sector to climate change, so that health facilities and services can withstand increasingly extreme weather. And our fourth goal has been to reduce the harmful emissions that healthcare produces. Health systems account for between 4 and 5% of global emissions, a percentage set to increase as demographics change and healthcare systems develop and expand. And so in order to meet the Paris Agreement, all countries must be supported to develop health systems in a sustainable and low-carbon way. And so we were absolutely delighted to announce earlier today that 50 countries from all regions of the globe have made commitments to build sustainable, low-carbon and resilient healthcare systems. This is what we need to safeguard the health of our people in the future. And this also includes a number of countries that have set a net zero target date for their health system, with targets as early as 2030. This is an enormous achievement, and the leadership from the health sector is inspiring. And I would encourage other sectors to show similar ambition. The world needs to follow the prescription of health professionals from right across the globe, to take just and equitable action on climate change that build futures that are not only greener, but also healthier. Because although we often talk about saving the planet, we all too infrequently speak the starkest truth. The fight against climate change is also a fight for human life. Thank you.
Thank you very much, dear Minister. You have been really extremely supportive, and your words are so stimulating. I'm sure you don't mind if I correct you a little bit, because we have new information just arrived that tell us that, in fact, there are not 50 countries, the ones that are committed, but 52. We just, yeah, thank you. After the big announcement that we made this morning with your support, Canada, Health Canada, says, you cannot do this without me. I want to be part of this commitment. And we have been very lucky as well to have a commitment from the Minister of Ivory Coast, wanted to join, and the number is growing. So I hope you don't mind that we are correcting the figures in a very positive way. Thank you so much. As you rightly mentioned, this is a question of protecting our health, human health, and our lives. And that's why maybe for the next COP, together with the big planet, we should add a couple of big lungs for people to understand how connected this is to human health. Not that air pollution or climate change affect only our lungs, but to give for people to visualize how much this is interconnected and how much we could gain. The room, as you can see, is amazing. It's really huge. It's a little bit Hollywood style. But I'm sure that this is what the health community deserves, and how health will be stimulating and motivating all of us participating to this. For those in this corner, maybe you will be more comfortable over there, but anyway, you are very much welcome. Please take the seats that you are comfortable on it. Patricia Espinosa not only is a good friend, she is an incredible woman, a leader, and of course the Executive Secretary of the UNFCCC. She was supposed to come here today now. She was very happy about it, and I know that she was very, very sincere, but I'm sure you understand that she has other business, other little negotiations to take care of. But she will be very well represented by Niklas Svenisen. Svenisen, is that okay? Niklas, you have the floor. Please come in.
Thank you so much for those words, and good evening, everybody. It's really a pleasure to be here today. As Dr. Neira mentioned, Patricia would very much have liked to be here, but being the captain of the COP ship requires that you're in 1,000 places at the same time, and sometimes that is just not possible. Nevertheless, I would like to deliver her speech in the words that she put here herself. Ladies and gentlemen, it is a great opportunity and privilege to be here today to share some of my insights into this very important topic. The climate crisis is upon us with real and devastating consequences for our health, particularly for the most disadvantaged around the world. The message from the small island states and other most vulnerable countries is 1.5 to stay alive. This is literally true. For the sake of our health, we need to break our addiction to fossil fuels. For every fraction of a degree of warming, about 1.5 centigrade, we see more extreme and deadly weather events, more outbreaks of infectious disease, and more threats to the air, water, and food that sustain lives. But a different future is possible. The evidence shows that the changes we need to make to our energy transport and food systems to meet the Paris climate goals will bring massive health gains, more than enough to cover the cost of mitigation. This will not happen automatically. We all have to step up. I'm therefore delighted that the UK COP presidency have put in place the largest health program that we have seen at any COP, with important initiatives on building more resilient and greener health system, on including health within nationally determined contributions to the Paris Agreement, and on applied research on health resilience and climate change. Even more important, countries themselves are rising to the challenge. We heard this morning that over 40 countries have already signed up to the COP26 initiatives on climate resilient and greener health system, and here, of course, I have to update that figure and saying 52. The most hopeful initiative of all is on mobilizing the voice of health workers to speak up for climate action. This is also the final recommendation from the report, The Health Argument for Climate Action, that the health community has sent to COP. Health workers are the most trusted profession in the world and save countless lives every day. On top of all of this, they are now leading by example in cutting carbon emissions to protect the lives of the patients from the threat of climate change. Health workers are also making their voices heard. Organizations representing over 45 million healthcare professionals from more than 100 countries signed a Healthy Climate letter calling on the world's leaders to take ambitious climate action for the health of the planet and its people. The importance of health in the climate change discussion is now clear, and I commit to take your messages to the presidency and to the parties negotiating here in Glasgow. I believe that bringing more health arguments in the negotiations will trigger bigger, better, and more ambitious results of COP26. Thank you.
Very much. We wanted to deliver the healthy prescription to the UNFCCC. I don't know whether we are ready for that, but for you to know that this healthy letter, the healthy prescription signed by 47 million health professionals is ready. If it's not now in the room, be prepared because we will jump on your offices and we will make sure that you get the letter. Thank you very much for coming, and thanks for your commitment and your support and your understanding of the importance of health and all of this agenda. We think maybe we are a little bit pretentious, but we think that if you use the health argument, you will be able to increase people's ambition and the speed at which they will take action. Thank you so much. To set the scene now and to create the environment for questions and reflections, Diarmid, can I invite you to the stage? Diarmid Campbell-Landrum, Dr. Diarmid Campbell-Landrum is the head of the Climate Change and Health Unit at WHO, our organization, and he will present you the 10 recommendations included in the health argument. Diarmid, over to you. Thank you.
Well, thank you very much, Maria, for the introduction. And as Maria has just said, my job is to quickly go through the recommendations that not only WHO, but the health community more broadly is sending to the climate negotiations. And these are not negative recommendations. It's not just a complaint. It's not just saying what a disaster we have. It is the health argument for climate action, because as you have already heard, we do think that the health argument for climate action is the one which has the most positive reasons to act on climate change, both because people are concerned about the impacts of climate change on health. If you ask people in the street what they're concerned about on climate change, you give them the list of the damages climate change will do. If health is on there, health will be their number one concern. But even more importantly than that, it's all of the health gains that come from acting on climate change. So there are 10 recommendations in the report. I will go through them relatively quickly, but hopefully this will set the scene. So the first recommendation in the report is to commit to a healthy, green and just recovery from COVID-19. The world has been devastated by the COVID pandemic. We've shut down economies. People have had their livelihoods massively disrupted by climate change, by COVID-19. And we think even quite early in the pandemic, we were very clear that as we came out of the pandemic, we had to do it in such a way that we promoted health. And in order to promote health, that means protecting the planet. And so any recovery from COVID-19 has to put its investments into things which are positive for climate action, which cut greenhouse gas emissions, and that don't basically prop up the fossil fuel and other polluting industries of the past. And that is not an environmental prescription, that's a health prescription from WHO to use those funds to protect our climate. The second recommendation in the report is to place health at the heart of the UN climate negotiations. And another way of putting that is that our health is not negotiable. We are very clear that although these are climate discussions, they are negotiations. There are negotiations about finance, technology transfer, and so on. One thing that absolutely cannot be on the table for negotiation is health. The Paris Agreement cites the right to health, and it is a right. It's not an option. It's not a nice to have if you can afford it. It's the right to health. And so the image that you see here is representatives of mothers' organizations from around the world who are campaigning on air pollution and climate change, meeting the COP President Alok Sharma, and they're not there to negotiate. They're there to assert the right that their children should be able to grow up in a world which is protected from climate change and is protected from the damage done by fossil fuels, including through air pollution. The third is to promote healthy climate commitments. So most of the negotiations now are structured around the nationally determined contributions. We see no reason why every NDC should not include health. Many of them are now starting to do that. Most countries in their NDCs now cite the health risks of climate change, and an increasing number also cite the health benefits that will come from climate action. We think that number should be 100%. Each of them can cite the health gains of climate action, and our colleagues at GCHA have carried out a fantastic assessment of the NDCs, which have currently been committed. They have a scorecard, and they're able to show that the best of these NDCs do cite all of the health gains that come from climate action. There is no reason why they should not all cite those health gains, because we think it's a really positive action, not just for health, but also as a motivation for stronger action on protecting the global climate. The fourth, and we've heard reference to this in the commitments, is around building health resilience to climate risks. So we already see lives devastated by climate change. We see lives lost to climate change. We see health infrastructure destroyed by climate change. This is an image of a hospital in Bangladesh, which has effectively been washed into the sea by a combination of more intense rainfall and sea level rise. These countries need support in order to have their health systems resilient enough to protect their populations from climate change. And that's why it's been so important that the commitments that have been made over the past few months and even in the past few hours, one of those commitments is on building climate resilient and sustainable health systems, and the other is on making those health systems environmentally sustainable and cutting their greenhouse gas emissions. So this is the slide that was shown in the presentation earlier this morning with showing the countries that have made this commitment. This slide is already out of date. As we have heard, we have at least 2 more countries to add. We'll be very pleased to add, I think, Côte d'Ivoire, and also to add the Canadian symbol to this map as well, and also to our Canadian colleagues to move the US symbol slightly further south to accommodate where it should be and where the Canadian flag will now lie. The next commitment is on, the next recommendation is on creating energy systems that protect and improve climate and health. And you will hear this figure quoted many times by WHO, that over 7 million people a year die from air pollution. That's about 13 people every minute. A significant proportion of that, most of the outdoor air pollution, comes from the burning of fossil fuels. So it's the same interventions that will protect the climate as will save lives now. We also have to work with the poorer countries to ensure they have access to energy in their homes and their healthcare facilities, and that should be ideally clean energy. It should be on the path to clean energy. So that's our recommendation number 5. The 6th out of the 10 is on reimagining urban environments, transport, and mobility. So most greenhouse gas emissions now come from cities. Over 60% come from cities. About a quarter of total greenhouse gas emissions come from transport systems. And we see now cities around the world, and I think we'll hear a bit more from examples of this in a minute, and countries around the world, including in response to the COVID pandemic, have been putting in place cycling lanes. They've been upgrading their public transport systems. And that is exactly the kind of intervention which will cut air pollution, it will promote physical activity, it will make our cities more livable, and will also serve to protect the climate. The 7th out of the 10 is to restore nature as the foundation of our health. All human health doesn't come from health systems, it comes from the natural environment. And so we are very clear that as health professionals, we should be speaking up for protection of the natural environment. That's where our clean air comes from, it's where our water comes from, it's where our food comes from. We cannot protect health on this planet unless we restore nature as the foundation of our health. We should be very positive and courageous about doing that as well. The 8th out of the 10 is on promoting healthy, sustainable, and resilient food systems. Again, we cannot protect health without doing this. We already lose, one of our major risk factors for global ill health is undernutrition. We suffer an even greater burden globally from overnutrition or poor nutrition, unhealthy diets. So we need to make sure that our food systems are resilient to the impacts of climate change, but also that we promote sustainable, healthy diets and food systems that will cut greenhouse gas emissions. And also, if we comply with the Paris goals, and if we comply with WHO's recommendations on healthy diets, we save, again, about 5 million lives a year, according to the recent estimates. These are massive health gains that are, again, a positive argument for climate action. The 9th out of the 10 is on stopping subsidizing pollution. The main constraint on climate action is that people say, well, it costs money, can we afford to do it? For one thing, we can't afford not to do it, including to protect health, but also we already spend too much of our money either directly in cash or in the cost that is paid in our lungs, effectively subsidizing pollution. And so the International Monetary Fund, their analysis suggests, or their assessment is that the fossil fuel industry currently receives about $5.9 trillion a year in effective subsidies. About half of that is the cost paid in our lungs. To put that into perspective, that's more than all health systems around the world spend on healthcare. The money is there, we need to spend it in the right way, not on things that effectively poison us and poison the planet. And the final recommendation is on mobilizing the health community for urgent climate action. We've already heard from Minister Morton and from others about the importance of this. And we as UNFCCC think this is the most hopeful recommendation of all. And so that letter that was signed by 45 million organizations representing 45 million, 46 million healthcare professionals is effectively the endorsement from arguably the largest and certainly the most trusted profession in the world, that we want to see climate action in order to protect the health of the people that they protect every day in our hospitals and elsewhere. And to be honest, they're rather tired of trying to protect people's health or treat people's health in hospitals and then sending them back out into a world which we're compromising by climate change. They're making their voice heard, and we're very happy to amplify that as WHO. And so the final slide here, the real reason that we are doing this is that this report that I'm summarizing here was produced in consultation with the wider health community. It was hand-delivered by bike from Geneva to London, and then with NHS workers cycling it, riding it from London all the way to Glasgow. So this is a copy of the report being hand-signed by Dr. Tedros before we then relayed it on. That's not actually the most important part of the report. The most important part of the report is the dedication. As WHO, as a UN bureaucracy, we don't usually dedicate our reports. It's seen as somewhat personal. We have dedicated this report to Ella Kissi-Debrah, who is the first person ever to have air pollution on their death certificate, a young girl from South London who was diagnosed by the coroner as having been killed by air pollution, because we think it is unacceptable that people accept air pollution, accept climate change damages without putting a human face on that. So we think that's the final, most positive, most forceful thing that we can bring as the health community for climate action.
Thank you so much, Diarmid. Please join me here because I hope everybody agrees with those 10 recommendations, and if not, this is the time maybe to open this debate. We think that they are based on a good diagnosis of the situation, moving then for us as the health community to provide some prescriptions, healthy prescriptions which are very common sense and for which we have the treatment, we have the drugs that we can prescribe. So to start to reflect on those recommendations, can I invite now Mr. Jagan Chapalgain, Secretary General, International Federation of the Red Cross and Red Crescent Societies. I'm sure you have plenty to tell us about how do you feel about those recommendations and whether you see that those climate risks are necessarily involved on what are your priorities and how we can tackle this together. Over to you, please. And then join me here for the panel discussion.
Thank you. Thank you very much, Maria. It's great to be here, and really thank you for the great presentation of 10 recommendations. As IFRC, as you know, we are the membership organizations, a network of 192 member National Red Cross and Red Crescent societies, and we fully support the 10 recommendations. We haven't signed it, but that's purely for technical reasons, and I hope we can sort out the technicalities. But we fully and strongly support these 10 recommendations. You know, I was listening to when you were presenting, and of course, a Secretary General of an organization which is very community-based, and of course, which relies on our 14 million community volunteers. I was trying to interpret those recommendations in a very simple terms. The climate affects food. It affects water negatively. It affects air negatively. It affects livelihoods negatively. It affects shelter negatively. All 5 or 6 things. What's the consequences of that? Health. So the arguments are very, very simple. Of course, there is a science behind it, there is data behind it, there is research behind it. But for someone like me, I don't need data. It's very, very simple. So the health arguments are very, very simple. And I strongly endorse and support the arguments put forward on behalf of my 192 member National Red Cross and Red Crescent societies. I think to collectively build the health resilience to climate risk, we need to place health and social justice at the heart of the climate talks to unite us in protecting and promoting well-being. And I think that's been said a number of times. We have a responsibility to ensure a future in which all people thrive, not only survive. And that's a very important argument. The health of people and the planet is fundamental for the prosperity of everyone today and future generations. Right now, as the global community moves from the pandemic response phase towards inclusive recovery, we must focus on building well-designed, community-based health programs and primary healthcare systems. This requires the involvement and participation of communities to make health systems truly strong. And here, I would really like to join those 45 million health workers who have signed. And one health workers that don't always get recognized are the volunteers. And 14 million of those volunteers work for Red Cross Red Crescent. And I know there are hundreds of millions of other volunteers. We have a statistics that for COVID-19, every day, for last 20, 21 months, there have been more than 1 million Red Cross volunteers. They have gone out every single day. While the message was, stay home, don't come to office, lockdown. But the communities and the most vulnerable people needed support, and the type of support that could not be provided virtually. Taking an isolated elderly lady to the hospital, you cannot do that virtually. You need somebody to go to the home, get the person to the ambulance, and carry that person to the hospital. And those were done by those 1 million volunteers. And one of the first volunteers who lost lives in Italy in February 2020 was that ambulance driver who was carrying that elderly person from her home to the hospital, and unfortunately, he got infected and he died. That's the first recorded Red Cross volunteers who died in February already 2020. And I would like to join that voice of those 14 million volunteers, to those 45 million health workers who have signed that petition. I think the aspect of resilience, and that comes on the recommendation many, many times, is extremely important. Building resilience to individuals, building resilience to communities, and building resilience to health systems, and especially in the rural areas, especially the photo you saw from Bangladesh. And there are many such communities in the world, and there hasn't been sufficient investment in those areas. And as we saw during the COVID-19, in many of the countries in Africa, in rural areas, health infrastructures didn't exist. And where they existed, there were no doctors, there were no nurses, and there was no basic capacity to sustain that resilience of the health system. And those were the countries which got totally overwhelmed, and we saw the consequences. So I think that resilience, building resilience health system, building resilience health infrastructure, and building resilience health workforce is extremely important. And I'm very pleased to join this WHO-led recommendation and strongly stand behind it. Thank you, Maria.
Thank you so much. Please join us. And let me take this opportunity to express all of our admiration, respect for your incredible organization. I think we all grow up listening about your volunteers, and we are very proud of that. So thank you very much on behalf of the health community, which is so close to yours. Thank you very much. Dear Mead, I think you have a funny thing with you there, a blue thing, and you forgot before to mention who was the person who was biking to deliver the health argument. So maybe we deserve an explanation. Can you provide it, this explanation?
I have to borrow. Yeah, thanks. Thanks very much, Maria. I'll provide the brief explanation. So the report and the letter are in this blue satchel, which the satchel was added as it left from Great Ormond Street Hospital, legendary children's hospital in the UK, in London, to be taken up to Glasgow. It's covered with messages written from patients within the hospital. And yes, the leg from Geneva to London, I did the leg from Geneva to London. So thank you for mentioning that.
Thank you. We are very proud of you. You're totally crazy, but we still are very proud of you. Thank you for doing that, Yermit. One of the recommendations presented by WHO was about reimagining the urban environment, how we will be looking at transport and mobility, how much this has an impact on our health, inclusion, and then how those cities are contributing to protect us and to reduce our vulnerability. And I'm very pleased that we have a fantastic representative to discuss about that, to reflect about that. We have Sharon Dieskema, Mayor of Utrecht. I hope she's with us. Yes, you are. Thank you very much. Welcome.
Yes, ladies and gentlemen, good evening. It is called Utrecht, but it is really difficult. So once you can pronounce the name of my city, I would say you're a real Dutch person.
Utrecht.
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 Utrecht is in the heart of one of the most world's densely populated countries. And I have to say that we are expanding rapidly. Within 15 years, my population will increase with about 20%. And a lot of people and companies are also attracted to Utrecht. And it is at this moment the fastest growing city of the Netherlands. And we're also a so-called mobility hub, with all national highways passing by, Schiphol Airport only half an hour away, and Utrecht Central Station, which is the largest train station of the country. So about 300,000 travelers pass this station each day, and that will be about 90 million a year. And more people, you can all imagine, mean also more movement and more air and more noise pollution, more pressure on the public space. So a few years ago, for instance, we recorded the first bicycle traffic jam of the world. And during COVID, our parks had to be closed down because it was simply too crowded. Not many people have houses with like big backyards, so they use public space in order to recreate. And we want to grow as a city, but without increasing the number of cars. And at the same time, we also see that we simply do not have enough public space for all these cars. I think that we want to have more quality of life for our citizens and visitors. So it is quite a struggle, actually, to achieve this. And therefore, we decided a few years ago to change our strategy and focus on health for everyone. And when I say health, I have to say I mean much more than health care. Health is about healthy people. It's about the possibilities to cope with physical, emotional, and social challenges in life. And it's also about autonomy and about having control of on your own life, about equity and equal opportunities. And so I have to say that health is actually at the core of all our policies. And I'm strongly convinced that that is a wise choice. And that is why we also invest in infrastructure that stimulates active mobility and discourages using the car. And therefore we redesign our streets, for instance, where the cars are the so-called guests and parking spots are removed. And we have bigger interventions such as the Daphne Schippers Bridge, a bridge solely for cyclists and pedestrians that crosses a big canal and connects the old and the new city. And the design is not only phenomenal because we have to cross the roof of a primary school as well, and it didn't look too good. And then the idea of integrating the roof in the design of the bridge, that was actually then at that time the real game changer. And now people from all over the world come especially to see this bridge. So we have a lot of people who are very clever in finding these kind of solutions. And we built a lot of new houses. Car sharing is one of the issues that we work on. And we have, and that is also a phenomenon that I would not dare not to mention. That is the single waterway. Last year, we finalized a decade-long project of turning a 12-lane motorway in the middle of our city into a waterway and park. And our citizens use the water for recreation. They walk or run along the canal and meet each other. And at the same time, the canal can also be used for adaptation. When we have heavy rainfall, it is a place to store all the extra water. So it actually cuts both ends. And we have also the biggest bicycle parking underground, I have to say, in the world. 3 stories right under our central station, and it hosts almost 12,500 bikes alone. So these are some of the examples in which cities can make the difference. And ladies and gentlemen, I think that that is really necessary, because we are discussing here with national governments on Paris, on meeting up our promises. But we have seen this evening and also past years that it will not go without cities. I mean, half of all the people live already in cities. A lot of the tasks are there for the cities. So if we do not align with each other, if there is not real money also for cities to make this all work, then I think Paris and all the agreement that we have been promised, it will just not be met up. And that would be actually, I think, a shame. So support the cities, because we are the real game changers, the drivers for change. Thank you very much.
Thank you very much. Please join us at the podium. We will be very happy. Many questions that I'm sure we will love to ask you, but you know, let me tell you something. In WHO, we used to call the mayors our ministers of health, because you can do miracles and be the game changers, as you rightly say. And the most fundamental question is, if it's feasible, why other mayors are not doing it? What are the obstacles? Why we don't put all of us health at front? In any case, I hope, if I was living in your city, I will vote you for sure. And maybe one day you will allow us to pronounce properly Utrecht. Even for an Spaniard, it's not easy. So imagine for others that they don't use the Thank you very much. Let me now invite, I'm sure that there will be very interesting reflections as well, Gansai Honorella. She's representative of the International Indigenous Forum on Climate Change, and I hope is around. Yes. Thank you very much. Please join us and share your reflections. While you are coming to the podium, can I invite to the stage, please, Jenny Miller, Eric Ngugunya, and Mohamed Isa? Can you please join us here, and then I will introduce you properly. Thank you very much. Over to you, please.
I appreciate it. Thank you so much. And ladies and gentlemen, panel, and thank you so much for this invitation. Tabea, Malona Kura Mahina. So that's, I'm greeting you in my indigenous language. And I will give it a try. Utrecht? Is that the right pronunciation of, all right. What I would like to, well, obviously I don't want to deprive you of your right to rest and leisure at this hour of the day, but I think it's very important to talk about your right to health. And if anything that we have realized the last couple of months, years, is how important the right to health is, how non-negotiable COVID-19 is, how non-negotiable our health is, that we need to take care of it, how vulnerable we are, not just individually, but also as a community, as cities, as peoples. And from an indigenous people's perspective, we've always been practicing our knowledge. Our knowledge keepers helped us with medicine. We have our own medicine. We also have our own healthcare. And something that I'd like to share with you is that in order for us as indigenous peoples to be able to continue our livelihoods, our ability to live on our own lands. Because the funny thing is that's not what a lot of people know, is that the knowledge of indigenous peoples is not within the person, it's within the lands, it's within our identity, it's within our culture. So our health and our healthcare is within our culture as well. We have protected the natural environment for millennia, survived climate shifts, and we have an intimate and sophisticated and very profound knowledge and practices that actually should be part of the solution of climate change. And as we all gathered here to COP26, we do see that this knowledge is very much important to be taken into account when you fight climate change. That expanding your knowledge base with the knowledge of indigenous peoples that have, well, we've been here since for millennia, so you could say that we've done something right. It is very important that health is not only at the heart of COP26 or at the heart of climate action, but also rights should be at the heart of COP26. I very much echo what the minister just now said. Fight for climate change is a fight for human life. But as we see right now at COP26, it is also a fight for human rights. Your right to self-determination, your right to health, your right to your own lifestyle. And we're prepared, we're ready, we want to help out. We want to help the parties to fight climate change, to ensure that we can continue living our lifestyles, that we can live healthy lives. We have indigenous knowledge holders that actually gathered on Saturday with a plea to be included in all climate action. And something that I would like to share with you as well is that from an indigenous point of view, health cannot be seen in isolation. Health, you should not quarantine health. From our point of view, health or bodies, it needs to be seen in a holistic manner. Everything is connected. Our worldview is that everything is interconnected. So health should not be isolated in a way that it's also be included in terms of the right to health. And that's why we are very much supportive and advocating for the right of indigenous peoples and the human rights in climate action. And don't take my word for it. There's a roundtable that I've heard a couple of weeks ago of traditional knowledge holders and healthcare practitioners wanting to contribute to the health community in terms of fighting climate change. And there was this, and they produced a very important position paper called the Climate Change and Aboriginal and Torres Strait Islander Health Position Paper, produced by Luigi Institute in Australia. And the stories that they tell is of the toll all these indigenous peoples are felt by climate change. There's an uncle in remote Australia that was facing extreme heat. He went away for dialysis and returned to find his power off. Food spoiled and medicines unable to be kept safely and cool. So that is why, from indigenous people's perspective, that health should not be seen in isolation. Health is part of us. Health is also a right. And that's why the rights of indigenous peoples, and as a human right to health, need to be at the heart of climate action. And that's why, in our view, health, all our rights are non-negotiable. And that's what we hope to see come out of COP26. Thank you.
Please join us. Of course, we need you. Thank you very much. A clear recommendation of the report, Jenny, I'm looking at you and the other participants, was the fact that health is non-negotiable. So we are not asking to be at the heart of the climate change negotiations because we want to negotiate, but we want to be part of that. Jenny Miller is the Executive Director of the Global Climate Change and Health Alliance and a very strong partner with WHO, with whom we have been obtaining all of those signatures and the healthy prescription. What are your reflections, Jenny, on this health is non-negotiable? What you will think about it?
Yeah, so, I mean, I think the pandemic is, has really crystallized that in a way that nothing else before has. We saw that a health crisis is not just a side event, it's something that shuts down everything across society. And if we're not protecting our health, protecting people's health from those things that are potential crises, everything is vulnerable and everything is at risk.
Thank you, Jenny. Can I invite now, we have with us Eric Njuguma. I'm sure I'm pronouncing horribly, Eric, so I don't mind to be blind again for pronouncing horribly. Please correct me. UNICEF, Fridays for Future Kenya. What are your reflections on that? You heard the recommendations. What do you think about all of this and your participation at the COP and whether health is important or not?
Thank you. My name is Eric Njuguna. That's how it's pronounced.
Terrible today, sorry.
It's okay, no worries.
Say it again, and Njuguma.
Yeah, Njuguna.
Njuguna.
Yeah, you're good. So I am a UNICEF young leader working on adolescent health with the UNICEF Adolescent Health team in New York. And there is no way, it's only from a privileged perspective would you separate health from the climate crisis, because there is no specific issue that is not interlinked to the other. The climate crisis is an intersectional issue, and it is only from a privileged point of view would you separate health from the climate crisis. UNICEF released a report this year talking about how 1 billion children, almost half of the world's 2.2 billion children, are affected by the climate crisis. And a good percentage of children across the globe are affected by air pollution. And as a result, there are a lot of health issues, respiratory issues. And you could see firsthand how the climate change has resultant health effects. I think that we need to come from a point where we're listening to the people who are being affected by the climate crisis more and see what their inputs are, because at this point, health is not something that is talked about in the climate nexus at this point, or public discourse on climate change. And not many people really are working on climate change as much, and we need to realize that the discussion on climate change is not only about mitigation, it's not only about whatever that is out there, but it's also about health. I feel like out of the people I have gotten the privilege to work with, or through UNICEF, some of the projects that we work on, I end up through Fridays for Future too. I have seen firsthand, or not firsthand, but through the people we are working with, especially at Fridays for Future in South Africa, children being affected health-wise, and just getting to hear their stories and knowing very well, having been at COP26, nothing that reflects their experiences in any of the policy documents. I think it's kind of aggravating sometimes to not see what is happening on the ground versus what is on the policy documents. And that is why we need to have more input from the most affected people in the areas, and the youth, because they bear the reality of what the climate crisis means to them. Yeah.
Thank you, Eric. Thank you very much. Let me go back now to another recommendation included in the report, which was like how to involve and the health community and how to prescribe and how to use their voice. Jenny, what's your reflection on that?
Yeah, the earlier speaker stole my thunder a little bit. I thought I was going to be speaking about how many people had signed this letter and all of these kinds of things. And it seems that the healthy climate prescription is actually, people are hearing about it, and it's already well known that the health community has brought its voice to COP. So I'd like to just kind of say a little bit about what that actually has meant. So again, recalling the times that we're in, what the health community has been doing for the past nearly 2 years is they've been on the front lines dealing with the pandemic in extreme conditions in hospitals, in clinics, public health professionals. In the United States, public health professionals have been threatened because they're trying to institute vaccine recommendations and masking recommendations. Environmental health practitioners have had to develop new protocols to keep us clean and safe, and all the practices that we're seeing here at COP. And so the entire health community has been working very, very hard. And, you know, it's no exaggeration to say that at this point they're burnt out, they're tired, they're stressed. And yet, in the face of that, they recognize that climate change is serious enough that they were willing to put in extra time after their long days, sometimes meeting, you know, from a break room in a hospital, to come together around this letter and sign this letter. So that's how serious they think climate change is as a threat to health, something that they, as health professionals, as the health community, really have to speak about. And you know, this healthy climate prescription is the largest mobilization of the health community. I need to offer as well a correction on the numbers, as was done on the country commitments. We now have 600 organizations that have signed on to the letter, and more individuals that have signed on. And that just continues because of the seriousness with which the health community takes this. So I think we're being heard. We're also not yet winning the day. So at this COP, I've seen more reference to health, more inclusion to health, than any other COP before. And yet health is not yet at the very center of climate policymaking and climate action, as you were saying. And so the health community is bringing its voice, has become activated, will continue to bring its voice. We can't stop, we have to, because climate change is a health issue. So we won't stop until health is at the very center of climate action.
Thank you, Jenny. And it's very rewarding with when others start to use your data, your numbers, and all of that. So the fact that everybody's referring now to those millions of health professionals, 45 or 47, I think there are now, is very rewarding. And it proves that people heard about it, and now they are motivated. It was interesting the other day, we got a complaint by a group saying, oh, we want to be included, and please include that. Make sure that we are there as well, because we are very committed to that. So it's really very, very good. We have a representative as well from the medical community, so the International Federation of Medical Students Association. And so I'm sure that you feel that from inside. What's the role of the health community? How do you feel the health community can contribute to that? Do you feel that we are properly and well represented. His name is Mohamed Isa, and he is the liaison officer for public health issues. Mohamed.
Yes, thank you, Maria. And she pronounced my name right, so my name was the easiest.
Oh, yes. But now I will call you Eric, Mohamed, Jenny, so no problem.
Yes.
Thank you.
So, yeah, regarding, like, first of all, I would just say, like, how we're feeling about this COP and how we're feeling about this whole experience. This is my first COP from my own personal experience. And like, as much as I'm satisfied with how we are doing as health community and how we're advocating for the inclusion of health in the center of the climate action, however, I'm still unsatisfied with the end result, I would say. Because from my own personal perspective, I would say that satisfaction in terms of the health and the climate change, it would be based on two factors, like inputs and outputs. From our side, we're providing the inputs in terms of advocacy, in terms of working and pushing for the inclusion of health. We're doing great, and we can even do greater. However, the output in terms of the results, in terms of health and climate justice, this is not, or what we're seeing at the moment is not what we are looking for. And what I would say is the missing ingredients for the recipe of the satisfaction in terms of the climate action in general with the inclusion of health is accountability, ownership, and commitment, which are unfortunately not present for the decision makers and the policy makers. For example, here in the IFMSA delegation, we would be held accountable by our members whom we are representing in terms of whether we actually represented their issues, we represented their thoughts about the climate change or not. However, does the decision makers feel the same? Do they feel that they are accountable for the health of their communities? Do they feel that everyone has their ownership in terms of the climate change and health? Actually not. That's the sad truth. So what I would say from our own personal perspective, or how the medical students and how the health community would do, I would say we need to keep on advocating and we need to keep on pushing. And from our perspective, for example, as medical students, we need the climate change to be there in our curricula and in our formal training. How would people and how would the medical students back there in my country, for example, know that the climate change is the main reason for all the death and for all the illnesses and for all the diseases they are receiving every day without getting educated about it and just getting educated about diseases, diagnosis, and management, and that's it. So we need this to be included. We need more, I would say, this we were discussing today in one of our meetings, we need more legally binding commitments, not just decision makers saying, okay, I'm committing to this and I'm doing this and this and that. Yes, this should hold them accountable, but unfortunately, they still cannot be held accountable, and that's why we're having a COP for the 26th year, because the decision makers are not doing enough. So this is another thing that we should be doing, and raising awareness of the population in general. Because one of the main tools that I find very, very strong is the indirect lobbying from the grassroots. People need to see that this is our right for health, this is our right for the climate justice, and we need to go there to our policymakers back there in our countries, because unfortunately this COP was exclusive enough that not many people were able to attend, so they need to do it in their own countries and get to advocate for their own health, instead of us just speaking on their own behalf. So all of these are different things, and I'm very happy, very, very happy that actually in one of the recommendations, in the 10 recommendations that were mentioned, that actually the health professionals were mentioned, that they can contribute to this, and they are the most trusted profession, and we need to make use of this trust and contribute to our communities, contribute to our societies. So our mission does not end in this COP, it just starts here, and then we will go back to our countries and work more for not just for COP27, but for future COPs. Hopefully there won't be future COPs if people get to work on the climate crisis. So, yeah.
Thank you, Mohamed. I'm sure that at the medical school, they are teaching you that when you have an emergency, when you have a patient who has a very serious health issue, you will do a quick diagnosis, consult, but immediately take a decision and react. You don't have 26 years to take decisions. You will have maybe 26 minutes, which is already a luxury sometimes. So here we have 7 million premature deaths every year caused by air pollution. We know most of the causes for that, so we have a very good diagnosis, and we know what the prescription should be. I still don't understand why it takes so long to take care of this patient. Mayor, Sharon, if you allow me. At the city level, as you rightly say, we could do enormous contributions to reduce the emissions and to protect people's health. And there will be plenty of benefits for the health of the people that I'm sure that the citizens can even touch it. I mean, they realize the benefits of that. Why, when you have such a good results, what it takes for some cities doing more action than others? It's a question of leadership, it's a question that you don't have enough evidence. What do you think are the problems for not moving strongly on this?
Now, I think first of all that it is by the big audience not so clear what the health issues, for instance, for air pollution really are. That it costs you maybe a few years of your life if you grow up in a part of the city where there is a lot of traffic or traffic jams. So I think that it starts with raising awareness about it. It is a silent killer. And not everybody is knowing this. So this is one thing. The second issue is, I also would say, has something to do with the social disbalance if you look at health. I mean, most of the times, people who are living in unhealthy conditions are also poor people. People who have a lot of things to struggle about. So I would take this also into account. Climate action has also something to do with creating a social agenda, because many of those people then are afraid that we take away the last resources that they still have. Their little car, for instance, which they use to go to their work. Or we want to change their houses and the way they are heated. So it is costly. So they don't see this as a benefit, they see it as a threat. And politicians make use of this, right? So what we need to do, I think, is raise awareness, be bold and brave, and have a clear agenda, not only for 2 years or 5 years, but for maybe 20 years, because you have also to be accountable for instance, entrepreneurs who cooperate with you. So I tried to do this in Amsterdam, where I was previously a deputy mayor. And I had this agenda by banning out all benzene and diesel cars by the year 2030. There was a big debate in whole the country. Not only the Amsterdam people were interfering, because they were more or less most of the time supporting me, the rest of the country was opposing me. This strange deputy mayor with this fantastic but not realistic ideas. What on earth is she doing? So that was not easy, because I was like standing in the middle of a storm, having a lot of debate around me, and not many people who would stand up for me. So this is what happens when you take a step forward. People try to oppose you, you get all kinds of political issues. Other parties try to outsource you, so to say. So yes, it takes a lot of courage, it takes vision, it takes a plan, it takes money, it takes a lot of convincement to put people on board. And I would say that our problem is, I think, this is why the climate agenda is such a polarizing agenda at the moment. We do not take our citizens on board enough. This is our biggest issue. I would like the COP to discuss about that. How are we trying to get people involved and let them feel that it is not an agenda of the elite, saying to them that they should change their behavior or change their lives, but it's their agenda, and they are also the first ones to benefit from them. I think this is the whole matter.
I cannot agree more. Thank you. Eric, you are a member of these Fridays for Future, and we can see that you are upset. We can see that the young people is really getting on very, very disappointed and frustrated. But when you see a leader that is trying to do something and doesn't have the support, maybe the is your movement considering to identify leaders and people that you can support and provide a good example and then stimulate more action? Is that something that the group is considering?
Well, I mean, that could mean so many things at this point, especially because how hard it is to get a really good person. In terms of like good looking for a good world leader, I don't believe if that would have existed, then at this point there would have been some effort in terms of like pushing things at COP26. At this point,
I was thinking at city level, maybe small, leaders that are trying to fight for changing things at the city where you live or something like that.
I think that it is something that we have been trying to push at all Fridays for Future levels, is it country or local groups, to try and push for action at city level. I don't believe at this point we have been able to reach that point where we can say that, okay, we have seen some progress with this person or not. Otherwise, I don't feel like if that was the case, then like a specific local group, they would have said and not be having problems, The fact that we are even striking in the first place means that no action is happening. Otherwise, there wouldn't have been strikes if there was action from, say, a specific leader. So the strikes, the presence of the strikes being there in the first place means that we are not seeing any action at any level. Yeah.
Thank you. Thank you very much. May I ask you, we have 1 minute and 2 seconds, but can I ask you, each of you, maybe a message, if possible, a little bit of hope as well? Can I start with you, Gazaeli? I'm sure I'm pronouncing wrongly as well.
Oh, you're not the first one, won't be the last one, but appreciate the effort. I'm sorry, the question was?
Leave us with a message on climate change and health, something that you would like people to reflect about it.
Yeah, in terms of climate change and health, health being at the heart of climate action, for many people, particularly COP26, is like waiting outside of the ER and waiting for the surgeons to come out and to say that the patient is okay. And I think the fear is that the surgeon comes out and then says, well, we've managed to save the patient, but we have to replace the heart. And I think the idea is to save the patient and to save the heart and to save all organs and save, yeah, so that we all can continue in a healthy environment, healthy people, healthy communities, and live healthy lives.
Thank you so much. Sharon, anything else you want to say?
No, I think I already said enough. I would say raise awareness, start with that, and be successful.
Excellent. Jagan?
I think on this debate, we also need to look into the impact of climate change and displacement. We just did a research. We found that actually more than 3 times more people are displaced by climate change than by conflict. And as you know, when people get displaced, their impact on health, particularly to the women and children, is massive. So I think that aspect we have to look at. And a very important aspect to look would be the impact of climate change on mental health. And particularly on the young people. I hear the young people is speaking here. And here we have a real responsibility for today's leaders that when you are dealing with the climate crisis, while this is a big crisis, we cannot make this the debate of hopelessness. When this becomes a debate of hopelessness, it impacts the thinking of the young people massively. So while we deal this as a crisis, we also have to send a message of hope. And listening to Mayor here, there are leaders. I know, I understand some of the frustration of our young people. I have seen leaders like Mayor here. And I think when we all come together, however difficult it is, however challenging it is, we will deal with it. And there is a future for the young people. And I think we have to send that message of hope.
Thank you so much. And the mental health is absolutely critical, yes. I'm happy you mentioned it. Jenny.
Yeah, as an emergency room doctor I know has been known to say the best antidote for eco-anxiety is action. And even more than that, action together. So the thing that gives me hope is, you know, I work primarily with the health sector, in the health sector, the coming together of the health sector to raise its voice on climate change is that position of hope. Together, if we work together, if we push hard, we can make the change happen that we need to see.
Thank you, Jenny. Mohamed.
Yes, like regarding hope, I would say two things. Yeah, like there is a quote that I really love from one of the movies. I can't remember the movie actually, but it is like my favorite quote. It says like, everything is going to be all right at the end. If it's not all right, then it's not the end. And I guess like this means that it's not the end, luckily. So we're still gonna do fine. And another thing that brings me hope is that like during this COP, my parents actually for the first time asked me about climate change. And like I explained and they were quite interested in this. So maybe like my message maybe, or since like tomorrow is my final day in COP, like sadly. But my message to the leaders and to the decision makers, especially those who failed their nations already, those who might be still failing them in the negotiation rooms, and those who might be thinking of failing them later. I guess like, yes, we will get our planet back the way it was created. We will get our good climate back, and we will get our well-deserved health back. But like in this case, like there will be no, like, we would be very sure that we will not be forgiving them for what they have done. However, maybe the question to them, how on earth would they be able to forgive themselves for what they have done? So yeah, this is the question maybe for them to think about. Thank you.
Thank you, Mohamed. Eric.
As a youth climate activist and someone from the global south, someone who has been affected by the climate crisis firsthand, it is sometimes astounding comparing what we are seeing versus, in our own communities versus what we are seeing in the negotiation processes. The disconnect is astounding. And from that, sometimes it can be hard to get hope or to be hopeful. But what gives me hope is the power the youth have to make a difference, the power the people have to make a difference. The fact that health is not even in the actively being talked about on the decision-making table is something that is aggravating, and we need to speak up about. That is something that should spark anger in each and every one of us. Don't just sit there, but join us. Join us in demanding for action, and that, if you just do that, you will get hope from that because you're speaking up. And the fact that sometimes there is silence is where like no one is questioning it, and the fact that there is silence upholds the status quo, and the status quo is in action. And that is not what we want. So if you just speak up, speak truth to power, that is more beautiful than hope. I don't know if there is another word for stronger than hope than that. Yeah, thank you.
Thank you, Eric. Thank you very much. Dear Meet, you are entitled as well if you want.
Well, thank you very much. And I'll just lead off from what we've just heard from our Fridays for Future representative, because I think one of the other slogans, as I understand, of the Fridays for Future movement is we're not interested in hope, we're interested in action, because when we have action, then hope is everywhere. And I think that the thing that gives me hope was actually the images that I came across in putting together that presentation of healthcare workers from Glasgow standing outside a hospital that had a projection of the number of people killed by air pollution in Glasgow on the building. The other slide that says, people make Glasgow. And those health workers, and particularly the nurses, tend to be women, standing there effectively saying, we're not going to take this anymore. And they're the same people who are protecting people's lives, but also cutting carbon emissions. So that action is what gives me hope. And the other thing is, now having spent time in Glasgow, fantastic city, wonderful people, and if a Glaswegian nurse tells you to do something, she'll tell you nicely, but you better do it. So I think that strong voice from the health community saying we want action is exactly what we need.
Thank you so much. Nothing else to add. I think the comments by all of them has been really absolutely wise, so we stop with that. Thank you very much for your participation. Please use the health argument for more climate action. So let's take care of this patient that is on a very urgent situation. We need to react, and the health community is ready for that. Thank you very much. Thank you.